Cloud. Okay, so like I said, this is Dr. Ed Hawkins from here in Morgantown, and he is here to talk to us about dental hygiene. So thank you, Dr. Ed.
You're welcome. In dentistry, you often have to take courses to keep up with things. And when I would take a course, I would consider it successful if I learned one thing from the course. So I hope to be able to teach you maybe two things, which would make me twice as successful as what I look for. Now I go from notes mostly when I'm looking down, mostly because even though I know the content, I tend to ramble if I don't keep myself on a course. So we'll start out with simple tooth decay. Decay occurs because there is bacteria on a tooth surface. The bacteria will produce acid, and acid will break down the tooth structure, beginning with the enamel. Simple brushing is going to clean about half of the tooth surface. The top is pretty easy because lower front teeth, upper front teeth, you really don't have to brush the tops. They're not going to, as a rule, get decay. So you've got the back teeth and you've got then front and back. We're trying not to use dental terms. There's a couple that I may have to use, but excuse me. So brushing properly is going to get front and the back. And it's best if you would use a rotary brush. The reason the rotary brush will basically keep you on course and you'll brush where you're supposed to be brushing instead of going all over the place. Now, a bristle brush such as this is fine. It will be effective, and straight bristle brushing, however, when you're doing it, going to make little circles and down from the top, little circles and down, little circles and down. It's kind of hard for me to see what I'm doing and demonstrate it, but little circles and down from the top and little circles and up from the bottom. Same way on the inside or on the outside. Now, what you don't want to do is to brush in a scrubbing fashion like that. It's okay on the top of the teeth, but not on the sides, because what happens is you might start to recreate notching, and notching occurs right here at the gum line. Which you can see on the model there, kind of hard for me, but the gum line is where it starts to be pink. Now, if this straight bristle brushing occurs and causing that notching, then sometimes it will lead later to bigger problems such as periodontal disease, gum disease. Okay, so now for many years, dentists blamed the patients for this notching that occurred. All of a sudden, with studies in later years, they found out that a lot of the notching occurred not because of bad brushing, but because of the way that the teeth were being used. And this is called abfraction and occlusal forces. The way that the top and bottom teeth go together in some patients will cause notching right here at that gum line. Now, the problem you face in dentistry is that the success in dentistry that is achieved over 50 years. We go back, I started dental school in 1970 and graduated in 74 and practiced for 40 years, and it's been 7 years retired. So we face problems that didn't occur before, because in 1970, the average 50-year-old had 6 teeth. Generally, they were the bottom 6 front teeth. They usually survive because they have the most saliva to wash things away. Now, the average 50-year-old has about 20 to 23 teeth. And we're back where we are. You've got the problems that are associated with patients keeping teeth that before they'd have an upper denture, lower partial, 6 front teeth. So back to where we started. We've got 2 sides that we have to clean, and that's in between the teeth. And that's where this come in. This is floss, and it's the only effective way that you're going to be able to clean in between your teeth. It's really hard, so I'll use me as my model. Teeth goes, and you go in between and down, slightly below the gum, come up, other side, and out in between all of your teeth, including the very back on the back side, because this is a place your brush doesn't reach and you're not going to get it and you're not going to be able to keep it clean. So only floss will work there. Now consider the fact that if you don't clean these teeth properly, decay will start, and it doesn't just start on one side. The teeth are together like this. And so what happens is that this tooth decays and this tooth decays because the floss isn't going in between the teeth. So you're going to affect two teeth when this happens. So floss. Now, please, no toothpicks. Toothpicks are a weapon. If you keep on pushing a toothpick in between your two front teeth, in less than a year, your gum will have gone away and you'll have a space in between your two front teeth. So don't do it. Now, next, have that hygiene appointment every 6 months to have your teeth cleaned. Now, most of you are under your parents' care, and they will love you and they will make you go to the dentist every 6 months. And they love you so much, they even pay for it. So take advantage. I always told my kids to suck off your parents for as long as you could. Go on every vacation that they always would say to you, and you're sitting there at age 18 or 17 or 16, and say, nah, I don't want to go. Go. They love you. They're going to spend their money on you. Okay, remember this. Wisdom from Dr. Ed. Now, when you become an adult, it's a little bit harder because now your decisions for your dental care is going to be based on different factors. It's going to be based on the factor of your time. It's going to be based on the factor of economics, your money, and it will revolve around this. But the good thing is, most of the time, your parents have taken care of you, and sometimes some of you will actually pick up the habit and keep on, but a lot of you won't. And you'll be sitting there thinking, no harm, no foul, nothing hurts. Why am I taking care and worrying about this when every time I went there, the dentist always told me, oh, you have perfect teeth. Well, that's true. Nothing's hurting, so it must be okay. Well, that's wrong. Decay does not hurt. Cavities don't hurt. Then all of a sudden you turn 30 and something breaks, or just perhaps you notice when you drink something cold or you eat something sweet, it hurts a little bit. It's sensitive. Now, welcome to the world of adults, because what has happened there is that your gums have went away from the neck of the tooth just ever so slightly, but just enough to expose the feeling portion of the tooth, which is the dentin. Now, we call it cementum there, but it's still dentin, all right? So that's the inner portion of the tooth. Now, the outer covering is enamel. Enamel has no feeling. That's why decay doesn't hurt as it penetrates and goes on through. And as it goes on through, it goes through the enamel into the dentin. And then finally, it reaches what we call the pulp and what patients call the nerve. It's not actually just a nerve that's in there. There's lymphatics, blood vessels, and nerve tissue. So we call it a pulp because, and that's what keeps the tooth moist. Everything comes from the pulp and radiates out through the dentin, then out into slightly into the enamel. So once you find out that it's penetrated the pulp, that's when you find out what a root canal is. We're not even going to go into that tonight, okay? But let's get back to that sensitivity at the gum line, because the dentin's been exposed. Very treatable. They'll put some fluoride, maybe some coating of paint on that area, and that will uptake it, and it will actually become better. Sensitivity goes away, and again, no harm and no foul. Now the x-rays might show some decay since you're there and you had to go have it checked out and you have it taken care of. Now the good news is that dentistry has gotten much more progressive, as has medicine. When you look back on what you had to do earlier, to put a filling into a tooth, you had to take a lot of the tooth structure away because the filling would fall out if it wasn't big enough. There's adhesive dentistry now. And what that means is you can actually stick a filling to a tooth and bond it to enamel. Now, this was just coming out when I first started. graduating from dental school, and it has continued to be expanded upon to where you can actually do a filling in what we call minimally invasive. Okay, I don't know how I got muted. I'm sorry.
Oh, that was me. Sorry.
So I didn't press a button. I swear to
That was
God.
me. Sorry.
So
It was me, Dr. Ed. Sorry about that.
that's okay. So 50 years ago, that preparation had to be big. In other words, if you were going to
Hello?
I'm still getting this mute hitting from somewhere. I don't know where. Okay. You're lucky, at least I know what that means. So now that we can do fillings much smaller and they look like tooth structure, because if you saw those fillings, that was amalgam, or what you would call a silver filling. And it was bigger so it wouldn't fall out. Problem was that the larger and the more tooth structure that you have to remove, then you have something that doesn't get moisture into it. So the moisture coming from the dentin out to the enamel doesn't get to the dentin anymore because there's a big filling in the way and the tooth gets drier. So all of a sudden, when you think everything is okay, crack, front of your tooth or the back of your tooth or the side of your tooth is gone. And then you learn what a cap or a crown is, and possibly a root canal as well. Again, we're staying away from doing dentistry. We're just talking about all the basics. So let's go back to the beginning. Brush, floss, have that dental exam every 6 months. Here's what not to do. Don't chew gum. This is a habit. It is a habit that causes you to repetitively use your teeth and doing no function whatsoever. It just moves and grinds down your tooth structure. It's not really a good thing, and it is a habit. You don't need gum, okay? Don't chew ice. When you chew ice, there's a chance that you would slip off of the ice, and instead of hitting where your teeth normally would hit, like these teeth, you hit edge to edge, like that. Well, the problem with hitting edge to edge is the only thing that's hitting now is the edges of these teeth, and it's usually cold. Cold things break easier. So that's a good way to chip or break a tooth, by chewing ice. So don't do that. Matter of fact, don't bite anything with your teeth except food. No plastic price tags, no threads, and especially no fingernails. Plus, that's gross. I know, because I started biting my fingernails in 3rd grade and didn't get broken of it until I went to dental school. But then there was this thought about having my hands in somebody's mouth and then sticking my fingers back in my mouth. That will make you stop, okay? So I stopped biting my fingernails at that point in time. This is before dentists wore gloves, by the way. Now, as with abfraction and that notching, there is a dental disease that we have come across that we didn't see 50 years ago, and that is enamel being eroded. And it generally was occurring on the fronts and the insides of younger children's teeth. We usually didn't see it in adults. And for a while, it was hard to figure out what is causing this problem. And it turned out that the case studies showed that it was really patients who were not abusing, but they were washing almost their mouth with soda, pop, and the chief offender was Mountain Dew, okay? Mountain Dew has a high acid content, and the acid on these patients ingesting a lot of Mountain Dew started to dissolve the enamel and would make saucer shapes out of the out of the enamel in the front and the back. And like I said, usually on younger adults, we didn't see this on 50-year-olds. They didn't have the habit. And seeing that, all the soft drinks have some acid content, but the highest ones are the ones that have Mountain Dew or lemonade flavors. So if you stay away from those, if you want to drink them, it's okay to drink one. It's just not okay to drink 24, 36, however many ounces is being ingested by some people to actually cause this erosion. So avoid these drinks or drink them through a straw. And don't suck on lemons either, because I've watched people do that. That is probably the highest way of putting an acid into your mouth to aid and abet, because the bacteria is already forming acid to break down your enamel. Well, now you just gave them more acid. So now, don't use tobacco products. And I know somebody says, well, don't use snuff, don't use. I'm going to give you the reason you should gently. If you use snuff, the snuff will burn the gum and cause it to go away from the neck of the tooth, exposing the dentin. Now, when dentin is exposed in this fashion, the bone goes down as well. So this is going to lead to an earlier appearance of something we'll cover in a couple minutes, periodontal disease. So you don't really want to do that. Smoking. Yes, I know smoking is bad for you. I smoked. I quit 33 years ago when my son was 5, and he asked me to stop smoking. But consider what's going on if you smoke. The chronic irritation from what is in the cigarette going into, and heat going on to the gums. So this will aid to push the gums away from the neck of the teeth, all right? It's just simply another form of a chronic irritation that causes beginning periodontal disease. Excessive use of cough lozenges, hard candies, and the like is going to contribute to decay, because you're just putting sugar, which is bacteria food, constantly by sucking on these type of candies. So now it sounds like you can't do anything, but you can. Teeth are meant to be used. They're just not meant to be abused. A good diet's important for overall health. That's why you have teeth. Now, more recently, another dental problem that surfaced, and again, I saw it more in younger adults than I saw in older patients, was that clenching, grinding of the teeth, causing the teeth to wear down excessively. And a lot of times what was necessary was to make night guards so that these patients would grind the night guards, because most of them did it at night, and grind the night guard down rather than grind their teeth. But some patients would do it during the day as well. Most of the time, a patient would do it because they were concentrating on a task, such as dentistry, that demanded a lot of attention, and you would start to clench and grind. So we make small day guards, and the day guards weren't meant to take the abuse, but a day guard would simply remind you when you started to touch and you would hit the day guard, then you would remember, I'm clenching. I don't really need to do this during this task. Now, I frequently used it because dentistry was stressful in some ways. You're always having to have things want to go your way. So let's get into that last disease process, which is periodontal disease. I really know that the problem, we didn't see it again 50 years ago because patients were down to the last 6 teeth. These teeth are awash in saliva, so they generally don't decay. I have a filling or a crown in every tooth in my mouth, except for these front 6. I'm not really proud. I didn't start out dentally well, but I finished well, and I still have all of my teeth. So, so periodontal disease, however, causes more tooth loss than decay. Generally, we can save the tooth if we can place a proper filling, but if the tooth starts to lose support, and it loses support by the gum going away from the neck of the tooth, and as this happens, so does the bone. So the signs are this: you'll see the gum receding first. You'll see some bleeding gums, meaning that there's inflammation. It's red. You'll have bad breath. And at the end of it all, the teeth are loose because there's not as much bone holding them in. So teeth not cleaned properly, when they're cleaning your teeth and they're going around with that little picky thingy, what they're doing is trying to remove any calculus that might have been built up. Now, calculus just simply comes from the saliva that you have in your mouth. In other words, you secrete it and it forms a deposit. Some of us are going to get more than others, and some of us in other places. Where the saliva ducts on the inside here, on underneath your tongue. So I have a buildup usually at the back, even though I try and brush very well, at the back of my 6 front teeth. Now, the body reacts to this because it's a clinical irritant. In other words, just like those other irritants that we talked about, this is something that's not removed. Then eventually you start to see gum going down, and it will eventually make what we call in dentistry a pocket. Now, a pocket is where the gum doesn't go all the way down, but it does go down on the inside. So once you get a pocket, and that's when they probe that little proby thingy around the back of your teeth, that's what they're checking. Now, they want to see, do we have a problem in between, in the front? Is there a pocket depth? That's the difference between the height of the gum and where it starts to attach to the tooth. If this attachment goes away and a pocket develops, then we have a different bacteria that's going to live down here than the bacteria that live up here. These ones up here, they're going to decay the tooth. These ones down here, they're going to destroy bone and other tissue. They are anaerobes, and they live in holes. Now, if you add any chronic disease or any chronic condition to this, it can be worse. So smoking, that's one, but the systemic chronic inflammatory disease, let's just take a simple one like diabetes. Diabetes is very common, particularly in our state. A diabetic is not going to heal as quickly, and they're going to be possibly predisposed, and the bacteria in the mouth are not going to, they're going to react in such a way that they will help this breakdown of the gum and the bone structure. Now, there's a great correlation, unfortunately, or fortunately, at least we know about it, between heart disease and periodontal disease or gum disease. And if you have periodontal disease, you're 2 times as likely to suffer from either a heart attack or stroke or some sort of heart disease, and vice versa. Because there is an inflammatory reaction that is set up here, and this is getting into science here, but it produces a C-reactive protein. And this is the primary association between these 2 disease processes of heart and stroke and periodontal disease. And the predictability of this potential is actually better when it's checked than looking at your cholesterol level. So this is a harder disease to understand, because when patients, again, don't suffer, just like the decay, they don't suffer the problem until the end, until you start to find that the teeth are loose, they're falling out, and what do you do? It's also linked, periodontal disease is linked to low birth rate, premature babies. What you may first see would be an indication, would be bad breath. Bad breath comes from those bacteria that are down in the hole. And it's more or less like a sulfur dioxide in nature, rotten eggs. It's what it smells like. So brush your teeth. Doesn't hurt to brush your tongue as well, because that'll get rid of some bacteria. So I always brush my tongue in the morning. Gets rid of that taste that's there, because everybody has it. Everybody knows what I'm talking about. You wake up in the morning and it's just like, yeah. So now, some patients are going to maybe have to have their teeth cleaned more often, just that twice a year, particularly as you get older. If the dentist says that, I would advise you to listen to it. Can you catch periodontal disease? Yeah, there's some indication that these type of bacteria could be transferred between two patients. In other words, a spouse, a significant other, whatever. So that's always a possibility. So it doesn't sound very good, does it? You know, when you look at all the things that I've told you, but you know, there's good news. The diagnosis is much better now. Used to be, you had x-rays and what you saw, but the x-rays only gave you a site that was one plane or on one pattern. And I used to demonstrate it when I would demonstrate to a patient why you couldn't see a tooth that was cracked on an x-ray. Because if I put my hands together like this, you see two hands. If I move them apart slightly, but you can only see it this way, all you see is my hand. You can't tell how far apart my hands are. That's the same way with right. When you take that, you only see from the front plane. Well, now you have x-rays that don't take 5 minutes that have to be developed like film used to be. It automatically shows up right up on that computer screen. But a special type of x-ray can be done that is three-dimensional. And what that means is you can cut this tooth, any single tooth, into planes, parallel or horizontal. Doesn't make any difference. So the dentist can see exactly if there's a fracture by looking at the horizontal look. He sees that fracture. I couldn't see that when I was working. It took a specialized x-ray to be developed, which was just coming out upon my retirement. So use of magnification. Most dentists, when they start out, basically, if I had perfect vision, I didn't need these things to see for magnification. But most dentists now use magnification, just as all medical personnel. You see better if you see it. I had 4 times magnification. That's pretty big when you look at it on the scope. And some even use microscopes. In other words, the endodontists, people who do root canals, they're going to use a big machine that has a way of looking almost right down the hole. Okay, so these X-rays, choice of materials, the materials are so much better than when they were when I first started out. See, this is, and we're talking the direction of this. What I've tried to tell you is that when you notice, it's not a decay mentality that I've been talking to you about. It's a health mentality. I want you to be able to be, I'm 73. I want you to be able to be 73 and have your teeth still be able to be used. And there might be one thing that I might have been able to sell you here tonight. Even losing a tooth sometimes isn't so critical because you can have implants. I have 2 implants where I had lost a tooth way before I actually got good dentistry. And this is something that is really was being developed during the course of my time of dentistry, but has become very predictable. In other words, you can place an implant with a great degree of success and it will stay in your mouth and it will support a tooth. Now it's only got one backfly. Man, there's a couple of things, but you don't get an implant. You'll never have a attachment to the gum to the implant. So you have to be careful about what you do when you're cleaning your teeth or what you're doing eating on that. But the aesthetics back in the old days, gold was used for a lot of things. Gold fillings here on these bottom teeth. I had crowns that had gold edges around the edge like that. And really, it really wasn't very pretty. It's just the way it was. The use of computers in the room, the X-ray comes right up on that computer screen. You can rotate it, you can cut it, you can look at it, you can do anything you want. You got digital X-ray, and you've also got a digital camera. You can put that digital camera right on the top of the tooth, and you can show the patient exactly what something looks like as big as that computer screen is, right? Then there's CAD/CAM technology. What that means is that there's the ability to have a machine that by taking an impression and feeding that information from that impression into the machine, it will make a cap or crown while you're there, and the dentist can simply put it in place. Sealants, I started doing sealants when I first graduated. So sealants have probably prevented more tooth decay in children than anything I can name. 6, 7 years old, as soon as you saw that first molar coming in, put a sealant. It's a plastic coat on the top of the teeth and the grooves so that the grooves don't decay. I want to show you this last thing. This is me. Those are my teeth underneath the teeth that you see that I smile with. These teeth, to save my teeth, even at the age of 18, had to all be crowned, and they had to be ground down to these little nubs. So that's what I've got left underneath. Yes, but it works, okay? But the thing is, you don't have to suffer having the done to you. Simple prevention: floss, brush, listen to what the dentist says, and you can end up not having all these. I don't regret. Bad teeth actually led me into dentistry. Had I not spent so many hours at the WVU School of Dentistry, I would never have been recruited to go to dental school. I didn't want to go to dental school. My degree is in English literature. I have a minor in history. I was not prepared in any fashion to go to dental school, but there were dental instructors there who took an interest in me, and they saw something that I would have the ability, because of my skills in carpentry, woodworking, to actually pursue a career in dentistry. I don't know how they saw it. I've always told people I've been fortune's child. I've always had not the success that I had no drive to go to dental school. As a matter of fact, when they first started recruiting me, I said, I want people to like me. Why would I want to be a dentist? And, I never worked a day in my life. So I really had a great career. I had a great time doing it. And, maybe some of you might actually look at this someday and say, maybe he was right. So I'll open to questions now, Ellen.
Thank you, Dr. Ed. Does anybody have any questions? Anybody? Apparently Jenny has a few.
Did you learn one thing? I'll ask that question. Did anybody learn one thing? Nobody learned anything.
Anybody?
Oh, no.
I learned I have a few bad habits, I think, Dr. Ed.
Ellen has a bad gum.
What's the most efficient way to brush with braces? I was muted.
With braces, you're going to have to step it up because if you don't get and use rotary brush tooth by tooth, because what's going to happen when the braces come off, where it's attached to your enamel, is going to have remained clean all that time while the rest of your tooth can suffer breaking down. In other words, starting to be. So what you'll see it look like is you'll have a clear middle, and then you'll have frosty edges all the way around. Now, some patients are born with teeth like this. My son's teeth is sort of like that. In other words, it doesn't really have that shiny surface to it's what we call mottled enamel. But you have to take much more care. Flossing is hard. Still got to use that floss, but you can get it in between the wires and go underneath the gum and clean there. But rotary brush is the only way to go. Matter of fact, most orthodontists I know give you a rotary toothbrush because they want to make sure that you're going to be encouraged to brush your teeth in the best fashion.
I should be taking notes, shouldn't I?
Well, Ellen said that this is being recorded. So I think you could go back and look at it again.
Hey, Miss Ellen,
Yes.
I got some bad habits to break.
Do you-
Me too.
Any other questions, guys?
Ellen, your baby's so cute. The baby's so
Miss
cute.
Ellen, I miss you.
Ellen, did I cover the subject in the fashion that you wanted?
I think that was really, I think you covered everything I would have known about. Thank you.
No, it's it's hard to stay. It's hard to stay away from some dental terms sometimes, and I do apologize for some of the basics. But if you really just figure on looking at the fact that you can't tell what's going on, in other words, that's probably the hardest thing. You can have a whole tooth decay away and not feel any pain until the bacteria get to the pulp. It's just a misconception that people, most of the time when they think they had a cavity, they were starting to suffer that gingival problem. In other words, that sensitivity at the gum line. And that's, mine occurred right. I had braces later in life. So I had braces when I was 25 through 27. Adult orthodontics takes longer to move teeth. You have to be more careful. And because of the shifting of the teeth, when the braces were off, then all of a sudden my teeth were very sensitive. That's when I discovered, another facet that I really wasn't aware of, and that's getting older. It's not for the faint of heart.
No, definitely not. Yeah, it looks like in the chat, a couple people have said they learned about that, ice and eating too many sweets is definitely not
It's not
good.
so much the sweets. I eat sweets. I eat a lot of candy. I know. I'd rather you eat candy and brush well. Okay. You just don't have to bathe your teeth in it. In other words, it's the prolonged use or the continued exposure. That's the problem, because when you look at it, it's food.
Yep.
It's food for bacteria. That's what it is. Basically, the sugars, that's, the bacteria love sugars, and they make the acid, and that breaks down the enamel. So I eat a lot of chocolate. You don't have to eat all milk chocolate. You can eat dark chocolate. I'm not saying don't eat candy. There's candy back there behind that bar. I assure you, all different kinds. Okay, but I brush well and I floss. So if you're doing, matter of fact, there's a toothbrush beside my bed. I don't even bother to go in and put toothpaste on it at night. Before I go to bed, before I go to sleep, I'm still brushing my teeth. Then I hang the toothbrush back up there. Same thing, in the morning, brush my tongue, floss, brush my teeth. Well, I use toothpaste, by the way, but I usually don't use it at night. I just brush my teeth right there, because if you look at it, if you brush your teeth at night, your teeth are going to be cleaner for 8 hours than they are from any other time, as if you brush them in the morning and then subject them to something else, maybe breakfast or lunch, and then brush at lunch, but then you've got dinner. Okay. If you brush at night, you've covered it for 8 hours, keeping it clean.
It looks like we do have another question in the chat. They want to know, what is a cavity?
What is a cavity?
Mm-hmm.
A cavity occurs when the bacteria have produced enough acid that it will go through the enamel. And once it's penetrated the enamel, it will go into the inner portion of the tooth, which is called the dentin. Once the dentin has been broached, then a filling must be placed at that time. That's a cavity. Now, once it's filled, basically we'll remove that, and we have stains that were developed so that you could actually tell what was good and what was bad dentin. So you would put once you would get the hole made, cavity prep, to where you wanted to be, well, then you can stain it and see whether or not there's still dentin that has decay, or if it's good solid dentin before you place your filling to replace the enamel and the dentin that's been removed from filling the hole or filling the cavity. And it's much better now because you can do it, again, minimally invasive, because you can make a smaller hole. Back in the old days, you had to make a hole big enough so that the filling wouldn't fall out. So when you looked at the filling, let's just say a filling that's on the front of a tooth, one of these gold fillings that I showed you, the hole's bigger on the inside, so it wouldn't fall out because there's no adhesive property. It's stuck there. So that we always used to make a little joke about it, about don't you worry, little filling, you'll be a crown someday. Okay, you're going to grow up, because that's what happened. The fillings just got bigger. It didn't happen on every patient, but if a patient didn't take care, the next filling was going to be bigger than the filling before it, the filling before that, and eventually the tooth would become drier, it would break, and you'd have to place a crown or a cap on the tooth, and then you'd have to pray that they would brush and floss the crown.
So another question we just got is they want to know, what is a good toothpaste to use?
Oh, I don't care. You don't even have to use toothpaste if you don't want to. I use still old dumb Colgate. Okay. All that stuff that they put in there, believe me, the whitening stuff, then they have to put more chemical. I'm not an anti-chemical person, but the point is, when you start putting all the additives in there to whiten the teeth, brighten the teeth, whatever the teeth, well, guess what? It all tastes terrible. So now you got to cover up the taste with more chemicals. So I'm a straight old Colgate guy, or a Crest. Doesn't make any difference. I just feel that that it basically gives you a good feeling in your mouth. Same way with a fluoride rinse. There's nothing wrong with rinses. Get one that doesn't have alcohol, okay, and has a fluoride. All right, so that you're not, because alcohol dehydrates or dries your tissue. Okay, that's another way of putting in a chronic irritation. Right, that's there's a lot of chronic irritations. Right, you can do a lot of bad things. Okay, we all know about the bad things we do. We're trying to accent the positive here so that you don't have the So my recommendation, like I said, I don't use toothpaste at night. I just brush my teeth. The mechanical action of the brush, if properly done, can clean the teeth.
Okay, another quick question.
I'm in no hurry. It's no problem.
Someone has
It's
a
not till 9
palate-
o'clock.
If you have a palate expander, how
Yes.
do you clean that?
Well, you can't take it out. Okay, so there you're going to have to work around it. I know what I know what's going on. Because you're how shall I put it? Sometimes the food that you like to eat is not going to be the best food to try and get out. So you're going to have, there's where you're going to have a recommendation, not so much as the fact of, because you can't, most of the time you can't get underneath it. Now, there are a few that you might be able to get the floss underneath and be able to cleanse it somewhat. But that's a difficult fact that when you've got it there, trying to make sure that you can maintain it as best you can. The nice thing is that, except for where it's attaching on the inside, it's generally not going to do any damage to your gum on the palate long term, because they're actually pushing your palate apart so that there'll be more room here. In other words, so you're not going to, your soft tissue there isn't going to suffer the damage that it would normally if you had something that was doing damage to the gums of the teeth.
Okay, and then what is your preference between motorized toothbrushes and manual?
Oh, all of you would do much better, with just a simple spin brush. You don't have to spend a lot of money. Okay, get a simple spin brush. Now, I use manual. I just grew up with it. I know how to manipulate it and do it well. But you can be lazy with a spin brush. All you have to do is hold it on the tooth. Okay, and it's going to go whirly, 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 and actually it will go in between the teeth slightly, maybe a little bit better than what I do with my, with my brush. But for all of you, and again, don't spend a lot of money. A $300 toothbrush isn't going to do any better job than a simple spin brush, except it will have whirly gigs and timers and everything else to tell you.
What about hydrogen peroxide toothpaste?
Again, you're just simply looking. The exposure of toothpaste in your mouth to whiten your teeth while you're brushing your teeth is pretty much a fable. Okay, it takes longer periods of exposure to brighten the enamel than, look, if most of you get 2 minutes in there, I'm happy. Okay, I mean, if you get 2 minutes of brushing in there, I'm happy.
Is it hydrogen peroxide toothpaste the exact same as alcohol toothpaste?
No, it's basically the selling point is there. It's going to make you whiter, brighter teeth. Well, is it going to make you whiter, brighter teeth for the 2 minutes that you put it on there? Let's be realistic about this. Okay, a lot of money is being made out there selling a lot of toothpaste that really doesn't have the ability. I mean, there's nothing, having fluoride on the toothpaste is, sure, it's great. I mean, but use a fluoride rinse. You got a better chance of having some intake of the fluoride into your enamel than you do probably from the toothpaste. Okay, the additives to the toothpaste are just simply a selling point. A lot of money to be made. Please don't think I'm callous because of that. I mean, I'm not anti-white. I can't have my teeth get any whiter because my teeth are all capped and crowned. Okay, you can't change the color of something that already has a fixed color, right? So I could possibly use, if you're really going to go for it, then you're going to have a customized tray and put the material in there and have it sit on the teeth, on the tooth structure for a period of time. If you're going to whiten teeth, if you want them whiter and brighter.
Okay, any other questions, guys? Dr. Ed, thank you so much.
No
I feel like there
problem,
was a
Ellen,
lot of
anytime.
information in there.
Thank you all. I appreciate it.
Thank you. Hey, for a couple of you guys that are signed on, I can't see your
Thank you.
names. So for attendance, if you could either sign into the chat or turn your phone, 97. We don't know who you are. Is there anyone else there, Paula, that we're missing?
The one that just says iPhone.
Yeah, and just iPhone.
Well, thanks for everything, guys.
Who just typed in the chat? Can the kids talk?
Yes.
How do I type in chat? Because I can't type.
You can too, type. You know home row.
You
Just
need
go
to
to the more
unmute.
button.
You need to
Not
unmute
fast
yourself.
anymore.
Victoria Eves.
Okay, Victoria.
How do I do it chat? Or do I just type?
Drew, go to more and then hit chat, and then there's like a field button so you can type in it.
Okay,
And then
so
who's the one that
who
just
was-
says iPhone?
Oh, I can't. This computer doesn't have voiceover on it.
Oh, geez, and I don't know.
Drew, is your mom around?
Send in a chat to that one.
Yeah, she is.
okay, so there's
Alright, get 'em in the
Cena's
chat.
just watching with JR.
It's Colton.
Colton.
Yeah, it's
Okay.
Colton.
So just type her name.
Yeah.
Look if I can type.
Well, if your name is, if we've already talked to you, we know you're here.
Yeah,
Thank
it
you,
already
Drew.
says you're Drew.
Yeah, but Drew wanted to chat with everyone, so I just wanted to make sure he had the chat window open.
I actually bought him some braille overlays for the keyboard so he could feel it.
Nice.
Ellen,
Yes.
Rochelle's here. She just doesn't have her iPad.
I'm here too. I have
And
my
Jocelyn's
iPad.
here.
Okay, wait, so we
I
have,
promise I attended.
What?
Paula, are you writing that?
Yeah,
I can't hear
yeah,
you. What?
Rochelle and who else? I have Jocelyn.
Rochelle's here.
Me.
Trinity's here.
Trinity was here.
She doesn't care.
Yeah,
We had Trinity already.
Came up.
And Morgan was here.
Morgan?
Lowe.
Morgan who?
Elizabeth Morgan.
Oh, okay.
I attended. Connie was here.
Connie was here.
I was here. Trinity.
They already know that.
I've had sweat.
Okay, Elizabeth Morgan and Connie. All right. Okay.
All right,
All
guys.
right, bye,
thank you so
guys.
much.
Bye.
No, don't make us stop.
Collins, what's to say hi to you?
I was here as well.
We have
Hi,
you.
Hunter.
All
We
right.
got you, Hunter.
Are you muted?
No.
Colton, wanted to say hi to you.
Now that they
Bye,
can
Ellen.
talk.
Yeah.
Bye, guys.
Bye, guys. Good night.
See ya.
Bye.
Peace.
Literally.
Hi, Jenny.
Oh, Miss Chrissy, Drew won't be at school tomorrow. I don't know if you know that. We're going to Morgantown.
Now realizing this.
Go ahead.
On a call with someone that Victoria wanted to talk to, and she was unmuted, so I yelled, "Victoria wanted to talk to you."
It won't let me leave.